a lot happening in Europe. We've got things like the NHS and Brexit that people over here have to learn and kind of know about as they make those to market plans. What would you say about the complexities of all of those systems?
From a registration perspective, we just need a CE mark.
Mm-hmm.
Once you have a CE mark, you can enter any market in the UK.
Mm-hmm.
But within the NHS, within the UK system, you do need to be qualified as a supplier or a distributor. And you also need to be qualified to enter some of the supply chains that govern most of the procurement within the NHS.
Mm-hmm.
And the NHS supply chain is an entity in itself. And it can take some time to get access to that supply chain, either as a supplier, manufacturer, or distributor.
Mm-hmm.
And then secondly, to get your product onto a particular contract or tender. So
Right.
you can't just stick a new product on, you have to apply, and sometimes you have to wait for the specific contract or tender to come up for renewal.
Mm-hmm.
And that's your only opportunity to get on with a new device. So it is complicated, and more so I would say it can take time
Mm-hmm.
to be able to get products fully onto NHS supply chain. We also have institutions like NICE,
Mm-hmm.
the National Institute of Clinical Excellence, and they drive a lot of what's accepted by the NHS in terms of new technologies, clinical practice, etc. And some newer technologies certainly have to look at getting NICE approval, particularly if they're new and novel and or expensive. It takes some time to get that level of approval from NICE. At a slightly lower level, there's a HCTED, which is a high cost tariff excluded devices. So some new products are governed under this HCTED, and it allows them to get approval and for the hospital to use them without costing them out of their general budget. So, but it can take time to get onto that. There's certain procedural areas that's covered, certain devices within those procedural areas that are covered on the HCTED. So it can take time to get them approved, And then finally, we have the whole Brexit situation.
Yeah.
It is going to be a new regulatory space in the next few years, particularly around CE marks. We have coverage for the next couple of years to July 2023, where CE certification, which has already been approved in Europe, will apply within the UK market. But ultimately, it could be that you will need a completely separate certification to be able to place your product on the market in the UK. But we're hoping that, we don't know what the deal yet is, but we're hoping that, there'll be a slight softness on that, and, CE certification may have an easier role, but I'm not involved in those negotiations for sure.
Right.
But we're very well structured, very well ahead of the game in trying to understand how we can support manufacturers coming into the UK market and how we can get them through this regulatory process.
Mm-hmm.
And once they understand and we put a timeline on it and people understand what that will take, then it doesn't put them off from coming into to Europe or to the UK.
Yeah, I mean, I can imagine that's one of the benefits of working with you guys is you are able to be pretty transparent with information and help guide these companies through this process and support that, and so that manufacturers aren't feeling a little bit lost in a sea of regulations, if that makes sense. Any advice that you would give to companies looking to enter Europe or maybe restructure their European strategy?
Yeah, well, look, I mean, I wouldn't, with all of the changes that are coming, so, be it Brexit or the challenges of what I've described in terms of getting into the NHS supply chain, we also have the MDD, MDR changes that are coming down the line, which will, certainly make it more challenging to get this approval in Europe.
Mm-hmm.
But, Europe is still a very significant part of any international entity trying to get full commercialization. So it's still worth coming to Europe, and we have loads of opportunity for companies to come to Europe. And I think, as you just described, a distributor gives access to those markets a lot easier than going direct. And even if it's an interim strategy, every company is different.
Right.
But for the UK, for example, any company that's trying to put their product, place it onto the market now, half the battle is already won if a company like SISK or the individual brands is already approved on the NHS supply chain, is already on a particular procedural area, or has an existing contract. So if a similar type product comes in, at least you have the work done to get into the UK
Right.
market. So I think that's an advantage, for any company coming or considering coming to Europe or UK specifically.
Yeah, I mean, I think that that is pretty much one thing that I think a lot of people kind of forget about originally as they're planning, that you have to take the time to become registered on those lists and be a part of it. Clearly, developing that to UK strategy has a lot of components to it. To close this out, Alan, what final bit of advice do you have for these manufacturers?
Well, I mean, all I would say is that, for American companies that are thinking to come to Europe and haven't decided on their commercialization strategy, we're here to engage with them at a very early stage,
Right.
and through your help, to identify some of those companies. And before you come to Europe looking for a distributor, engage with us, because we have a lot of expertise. We're in multiple procedural areas. We cover multiple geographies, and we have 20, 30 years experience of providing distribution capabilities to companies. We've brought an awful lot of brands to all of our markets. Some of them have gone on to be very successfully acquired.
Right.
Some have developed into a full line provider themselves and have stayed with a distribution model. Some have gone direct and come back to a distribution model. So, everything is to play for in Europe. It's still a very successful place to commercialize, and there's a lot of experience. And I think with the help of Unifar as a very successful and large PLC, with the focus on the medtech group that we now have, and the strategic objective to become a fully pan-European medtech entity, then I think we offer a lot of opportunities to companies that do want to come to Europe and do want to come to the UK, for myself specifically, and Ireland and the other markets we're currently in.
That's amazing. Well, I will be sure to make sure that we keep you connected so that as we have questions and possible manufacturers have questions, we will make sure they're connected in the right way. Conversation never hurt anybody. Thank you so much, Alan, for being here. I really appreciate your time. I will be providing a link in the bottom if you have further questions, if you're listening to us here. Otherwise, I hope you have a great afternoon. Thanks, guys.